had a patient come in who had seen 4 physicians in 2 years. She wasn't a complainer. She wasn't looking for validation. She was looking for an answer. She was exhausted. Her hair was thinning. She was gaining weight despite not changing her diet or movement. She was sleeping through the night but waking up tired, and every physician had told her the same thing. Your labs are normal. When I reviewed her records, I noticed something interesting, that 2 tests that ultimately explained most of her symptoms had never been ordered. And that raises a question I think more people should be asking. How can someone have normal labs and still not feel well? I'm Dr. Kelly Brown, a board-certified family medicine physician and the founder of Ember, a concierge primary care clinic in Arizona. And if you've ever been told that everything looks normal while knowing something still feels off, this video is for you. Here's the easiest way to think about a standard lab panel. Imagine your child comes home with a report card full of C's. They're passing. No teachers calling, no interventions required. Technically, everything's fine, but nobody looks at that report card and says, wow, they're performing at their full potential. That's kind of how I think about many lab panel results. Normal means you're passing. It doesn't necessarily mean you're thriving. And that's because most lab panels are designed to answer a very specific question. Do you have a disease? But that's often not the question that patients are asking. They're asking things like, why am I exhausted? And why am I gaining weight? And why don't I recover the way I used to? Why is my focus different? Why don't I feel like myself? Those are different questions, and sometimes they require different data. Let me show you what I mean. One of the tests I often ordered, and I ordered for this specific patient, was a fasting insulin. Most people know their glucose, and many know their A1C, but very few know their fasting insulin. But fasting insulin is one of the earliest markers we have for metabolic dysfunction. And this is where things get interesting. Your body can work very hard to keep your blood sugar looking normal. So the report card still says you're passing. Meanwhile, insulin levels may be climbing behind the scenes, sometimes for years, long before your glucose becomes abnormal, long before someone's diagnosed with diabetes, and long before anyone tells them they have a metabolic problem. The report card says they're fine. The physiology says something different. The second test I ordered was ferritin, not a CBC, not a hemoglobin, but ferritin. And this is a marker of stored iron. Her ferritin was technically within the normal laboratory reference range, but it was low enough to explain many of the symptoms she'd been experiencing: fatigue, hair thinning, poor recovery, reduced exercise tolerance. Again, the report card said she was passing, but it didn't really explain why she wasn't feeling well. And this is where I think so many people get stuck. People assume normal and optimal are the same thing. They're not. Normal is a statistical term. Optimal is a clinical goal. Normal means your result falls somewhere within a population range. Optimal asks a different question. It asks, is this where you function best? That's a very different conversation. And that's why I often look at additional markers like free T3, HSCRP, fasting insulin, and ferritin when I'm trying to understand why someone doesn't feel like themselves. Not because I'm searching for a diagnosis or a disease, but because I'm trying to understand function. Which brings me back to this patient. After 4 physicians and 2 years of frustration, she wasn't looking for someone to tell her she was right. She was looking for someone to connect the dots. When we looked deeper, the patterns became obvious. Early insulin resistance, low iron stores, nothing dramatic. Nothing alarming, definitely nothing that would have triggered an emergency evaluation, but enough to affect how she felt every single day. We addressed those issues. Over the next several months, her energy improved, her hair loss stopped, she lost 11 pounds. More importantly, she finally understood what had been happening. And that's really the point of this video. A normal lab report is good news. It means you're not in crisis, but it does not automatically mean that you're functioning at your best. Those are 2 different standards, and a normal lab report answers one question: do I have a disease? But many people ask a different question: why don't I feel like myself? And if you've ever felt that disconnect, if you've ever been told everything looks normal while knowing something still wasn't right, You may not be imagining it. You may simply be asking a different question than that lab panel was designed to answer. If you've ever had that experience, I'd love to hear about it in the comments. And if you're enjoying conversations about longevity, hormones, metabolism, and proactive healthcare, subscribe so you don't miss the next video.